Got aches and pains in your back? Well, you are not alone. 4 out of 5 of us will experience significant back pain at some point in our lives. Here with some expert advice about what's making your back ache and how to fix it, perhaps more importantly, is chiropractor Stephen Shoshany. Stephen, good morning, and nice for you to be with us.
Good morning.
So as we just mentioned, most people at some point in their lives are going to experience some sort of back pain. What's the most common cause?
Well, the most common cause is a mechanical problem. So to really understand that, we need to understand some anatomy. We're dealing with the spine. We're dealing with 24 bones called vertebrae. We're dealing with discs and spinal nerves. Basically what goes on is the brain sends information down the spinal cord through these spinal nerves, and these spinal nerves join and make larger nerves like the sciatic nerve that runs down the back of the leg. What happens is these spinal bones shift out of alignment and cause irritation on these very delicate spinal nerves and or muscle imbalances like weak abdominal muscles or tight back muscles.
All right, and so, I mean, is back pain usually caused by a sudden injury, or does it build up over time?
Well, it can be caused by a sudden injury like a slip or a fall, but also accumulation of stress like sitting at a desk for too long or bending the wrong way or picking up your child the wrong way.
So the older you get, the more perhaps, I guess, likely you are to get vulnerable, might be another word, yeah, to have back pain.
Absolutely.
And let's talk a little bit about one of the most common forms of back pain. That's the lower back. What's going on with that?
Well, the lower back is at the bottom, so more of the weight is being carried on the lower back. So even the slightest misalignment can cause irritation to a nerve or a disc, and that can cause pain or dysfunction.
Does back pain just go away on its own at a certain point?
Well, the symptoms will go away, but if you never fix the underlying cause of the back pain, it's bound to come back.
Talk about some of the other common points of pain, of back pain. I know herniated discs are a big problem that a lot of people experience. What causes that?
Well, the disc is an avascular structure, meaning it doesn't have a good blood supply. So once a disc is injured, it will remain injured unless it's treated. So it needs to be treated as opposed to simply getting rid of the pain.
Let's talk about some of the treatments. You're a chiropractor. There's also the option of going to a medical doctor, physical therapy, maybe all three together. What different types of options are there for folks?
Well, in my office, we use a three-prong approach. All the doctors are there. So the medical doctor's there, the chiropractor, and a medical doctor. So whatever the patient really needs. Most of the time, the chiropractor will find a mechanical disturbance and correct it, and the physical therapist will work on stretching the muscles and strengthening the muscles.
Here's the big question I think a lot of people have, because when you think of back pain, oftentimes it's referred to as chronic pain. So is this something you always will have to maintain, or can you fully recover at some point from back pain?
You have to manage it like you manage your car. You bring it in for tune-ups and wheel alignments. You have to manage your back by making sure your spine is properly aligned, your muscles are strong, and your muscles are stretched.
All right, and lastly, what are some preventative measures people can take to try and avoid getting into this position of having back pain? Stretching
is very important, making sure that you stretch often enough and making sure that you have proper ergonomics when you're sitting at your desk. You're not slouching. Making sure
No, I'm realizing I think I'm slouching right now. Okay.
And making sure you drink plenty of water and plenty of exercise and rest.
Okay. All right. Stephen Shoshany, thanks so much. We appreciate it.
Thank you.
And tomorrow we're going to find out what's causing